And thank you for joining us this Wednesday on the Glam. This is where your beauty is cherished, your wellness is prioritized, and your heart is treasured. My name is Tracy Wanjiru, and today we are at You Glow Aesthetics. So today we're looking into the world of Botox, of fillers. So if you're considering it, if you're curious, or you just want the facts, then this is the place to be today. I'm so excited because this is something that I've been really looking forward to learning about, and I'm sure there's many of you at home who are just like me. So let's go meet our esthetician for today, and she is a certified injector, so we are in great hands. I think one of the many things that I have learned on this process on the Glam is that you need to find the right people to administer the treatments for your skin. You're not just trusting anyone with your skin. Make sure that you trust the right people on your journey. So let's go and meet her, and let's get to learn all about Botox and fillers. Let's go. So I'm here with my namesake. This is Wanjiru, who is going to be administering the injections today. And we also have Jean here, who's our client. Hi, guys.
Hi.
I'm excited to be here.
We're so excited as well.
Fantastic. So Jean, tell us more about your journey with Botox and why you decided this is something that you wanted to do.
So I think what I like about Botox is being on my 30s now, it's more of a preventative measure. Just to prevent those wrinkles that they come over the years.
Okay.
So I've done this the second time, and I love the results so far. And I've seen like a very great change with the different lines that I used to have on my skin.
Okay. How painful is the process?
So the process is painless. They usually use a very tiny needle to inject.
Okay.
And then also the content of Botox is very little. Usually it comes with different ml. So, and the type of needle that is used is very bearable.
Okay, fantastic. So now we're going to hand it over to Wanjiru, who's going to take us through the entire process, and we get to see firsthand how it works. So yes, I'm excited and scared at the same time. So Wanjiru, thank you so much for taking us through the entire process. But before we even start, what is Botox? And is Botox and fillers the same thing?
Okay. So first of all, Botox is a toxin called botulinum toxin. Well, we use it to temporarily paralyze the muscles on the face for a short period of time, and then we can redo it again. But for fillers, the difference with fillers is that it's used to volumize the face or add to where we have lost. Okay?
Got it.
Yes.
Okay. So when you talk about paralyzing something, I'm
Yeah.
like, why do we want to do
scared.
that?
Yeah, you're scared.
Yeah, because if I'm paralyzing something, I'm thinking maybe then you render it useless, right? So is it beneficial for you?
Okay, so what happens with the face, we have facial muscles now. The reason why we have the facial lines, the forehead lines, is because we have facial expressions and facial movements. Now, when we give Botox, we are not trying to completely paralyze the whole face. We are just doing it temporarily. We are blocking what we call acetylcholine. So what it does, it helps with the contraction of muscles. Now, if we contract, if the muscles contract and keep on relaxing, now we form the lines.
Okay.
But now when we inject the Botox, there is no contraction. The muscles just relax. And normally when we do it, somebody else is not supposed to notice that you've done Botox. They're only gonna realize that there's a change in your face. Maybe you've been resting well, but it's not supposed to be evident that somebody has done Botox on your face.
Okay.
Yes.
So in what other circumstances can you use Botox other than, you've talked about the lines. How else can we use Botox?
So before Botox was used cosmetically, it was before used in medicine for conditions like chronic migraines, where different injections are given to the scalp and to the neck to help cure the migraines. There are also other conditions that are used, that Botox is used to treat, but now it's used cosmetically to reduce the lines on the face. Yeah.
Okay.
And give you a youthful look.
Amazing. So now Jean is here and she's our client, but for someone who's never seen the process or understands what happens, take us through what happens in a session.
Okay. So first of all, we'll do an assessment of your face. we have to do an assessment of your face when you're still, without making any facial expressions. When we do this, we are able to check areas where we have wrinkles when you're at a still state. We're also going to check for symmetry, and now areas that need maybe improvement or something else rather than Botox. Yes, then after that, I'll tell you to make facial expressions. I'll tell you to raise your brows. I'll tell you to squint your eyes. I'll tell you to frown, so that I'm able to mark the specific areas that require Botox.
Okay.
Now, with the forehead, the crow's area, and this area between the brows, we give specific amount of Botox. We give a particular amount, yeah? So for the forehead, we allocate around 20 units around the forehead.
Okay.
Here, this muscle is usually a bit denser for some people, especially men. So we might end up giving more units here, about 25. And around the crow's area, we give a little, about 15 on each side, 10 to 15 on each side.
Okay.
Yes.
So as I hear you talking about symmetry and, you know, all that stuff, I'm just thinking, is there a need for all that perfection from a nurse's point of view?
Okay, so I think I might answer your question in a broad way. So one, I'll say sometimes most of the clients we get who want Botox are mainly in their late 20s, early 30s, 40s, 50s, yeah? So we do not expect someone who is around 18 years of age to come get Botox. If I get someone younger, I'm gonna question, why do you want to get Botox right now? Your skin is young, you don't really need all that. But now when we do the history taking of the client and get the client's reasons as to why they want to get the Botox, we are able to say this one requires the Botox. It's okay, we can do it, because for some clients, they genuinely need it because they have wrinkles, they have sun damage, they have the frown lines, the crow's feet. It's a lot. Okay, so we need to do an assessment to be able to determine who is the best client for Botox.
Okay.
Yes. So we're going to do an assessment of her before. You're going to look at her face when she's seated still. So if you look at the forehead, we are going to assess for any visible lines or wrinkles.
Got it.
And if we look, when she's at a static state, we do not have any visible lines around this area.
Yeah.
Now, if we assess the in between the brows, we can also see the area does not have any visible wrinkle. But if we assess the eye area here, this is called the crow's feet, we can see we have a visible wrinkle right here, right? Yeah. So if you check here, we have a small wrinkle that is extending to this area. You see? And also on this side. So those are the visible ones. Well, the face is at a static state. Now I'm going to tell her to do facial expressions, and then we're also going to note for the lines. Now you can open your eyes, Jean. Now I would like you to raise your brows as much as you can. So you see, if she raises her brows, remember we had done a Botox a few weeks ago. Yeah? Again. Okay, so for the forehead, when we're injecting the forehead, we also have landmarks. There are areas we cannot inject. So I go about 2 centimeters above the brow, and I do not inject anywhere past this place where the arc is. Okay? So when I tell her to make an expression, do it again, Jean, please. So I'll look at here. You'll see there are small, very small lines which she wants us to get rid of. So we are going to give a very small amount of Botox on this area, maybe about 4 units. One, you can do it again, Jean. 1 here, 1 here, 1 here, 1 here. We'll assess other areas and see if they need more. So I'll tell you to, yeah. So you see here we have very big wrinkles and lines here. So here we're gonna give her 1, 2, and 3. It's okay, you can relax your face. So 1, 2, 3. Remember I told you this is a very heavy muscle.
Yes.
So here we're gonna give 4 units. That's 1, 1, 1, 1. But for here we're gonna give about 3, 3, 3. Okay, because it's a heavy muscle. So we're gonna give a total of 9 units.
Okay.
So 9 plus 4.
Yes.
Exactly. Now I'm gonna tell her to make an expression around, yeah, like that. And you see, the crow's feet, we're gonna mark 1, 2, and this one for the wrinkles that are going that way. And I'm gonna come to this side. Good. Gonna do 1, 2, again. 3. That's it. Now for the eye area, the skin is very thin, so we are also going to give a small amount of Botox. We're going to give 2, 2, 2. So 6, 6, 9, and 4.
Yeah.
Yes, so
oh, wow.
After that, I will just disinfect her face and then we proceed with the Botox.
Okay. So other than the young people, you know, they still have a lot of fat and muscle, everything is put together nicely.
Yeah.
Who is not eligible for such a treatment? Who do you look at and you're like, baby, end at home?
Yeah.
I love the money.
Yeah, but
I love working on my clients, but just go home.
Number one is a pregnant mother or a breastfeeding mother. Well, the safety of the Botox has not been proven, so we do not administer it to pregnant or breastfeeding women just for safety reasons. So if also someone has a neuromuscular condition, that is a problem that comes with the muscles and how they work, and which could be from birth. We also don't deal with such clients. Also a client who has an allergic reaction to botulinum toxin, we also do not administer that.
Okay.
Yes. And also, we usually consider clients who are on some medications like blood thinners or antiplatelet drugs, because the bleeding risk is a bit high. So we will tend to tell them to maybe stop the treatment for a few days. But for such clients, they'll need to see their physician or their doctor so that they can be able to stop the medications. Other than that, we tell you to stop aspirin or any non-steroidal anti-inflammatory drugs for 24 hours before the procedure. So we're going to administer the Botox. We store it in the fridge about 2 to 8 degrees Celsius. It needs to be stored in a cold area to maintain its potency.
It looks tiny, but you know what? It's
a small one. So it's about 30 to 32, gauge 30 to 32. It's a very small fine needle, also called the insulin needle.
Okay.
So it's made in that when I inject on the skin, she won't feel as much pain. I can describe the pain as a small pinch that disappears in about a half a second after every injection.
Okay.
Yeah.
Jean, where would you say you kind of like feel the most discomfort? Is it here? Is it here? Where?
I think for me it's on the forehead.
Oh.
I feel like I have thin skin and it's closer to the bone.
Okay, okay.
This is to disinfect the areas we are going to be injecting. We're done with the forehead.
Okay.
So you will notice there's a small bruising.
Yeah.
So it's part of the injection. It's like a side effect because we have punctured the skin.
Okay.
Sometimes the area might react a little bit and you might have small bumps or some bruising or a little bit of bleeding, but it's not a mass.
Okay.
Yeah. We'll be doing the crow's area where we are doing 2 of each, so we'll do a total of 6. You can squint your eyes. Yes. Perfect. We are done. Yeah. So I'm now cleaning the face again because I had done the markings with the pen. So I don't want her to go home with the white discoloration. So I'm going to wipe this area. Then I'll apply a moisturizer and a sunscreen for her.
This was extremely fast.
Yeah. And also we usually have like the patient teaching now after going home what you should do. So we tell our clients to avoid makeup for 24 hours, strenuous exercises that involve the face for at least 48 hours. Make sure you don't rub your face, you don't do facial massages for at least 24 hours.
Okay, so we're done. But before we even say goodbye, Wanjuru, we want to understand why there's such a big, you know, sort of like fear when it comes to Botox.
Yeah.
One of the things that I hear a lot is that if I start using such things, won't it affect my skin when I'm older?
Yeah.
And then, you know, give me alternate effects, you know. What would you say about that?
So there are a lot of misconceptions around Botox. If you ask many people, they do not want to do it because it's cosmetic and many people have had so many myths concerning cosmetic procedures. But now, once with the notion where if you get old, maybe your body still needs Botox, things like that. Now, we usually have things like sun damage, environmental factors that will make your skin age. And once you're around 50, 60 years old, your face is already old, right? And you still have the effects that come with age, such as the wrinkles. Now, for someone who has been doing Botox earlier on, you'll figure out in their 60s, their face is not as wrinkly as someone who has not had a chance to experience Botox. So it kind of gives you a better appearance even in your older age. It doesn't make you dependent to it. Because for her, now, we did a touch-up. The next time she's going to come here is in about 4 to 6 months. Yeah. If she feels there's need for us to do more on her face,
So, Jean, now this being your third session, do you feel like it's something that you're addicted to? Because that's also something that people say that you'll be heavily addicted on Botox, fillers, you know, such kind of cosmetic surgery procedures.
No, I can't say that. I think it's more of like every time you make your hair, if it maybe spoils, you want to go back and make it. So it's more of like the feeling of looking youthful that will make me come back. But I've had months that I've gone a few months without Botox and nothing has happened.
Okay.
You wouldn't notice a change on a before and after, because most of them are usually caused by the movements.
So how many sessions does a client typically need for a year, and how much does it cost per session?
Okay, so mostly for new clients who have not done Botox before, so we charge it about 1,000 per unit. So for a typical client, they might need a minimum of 15 to a maximum of up to 50, just depending on how much we are dealing with.
Oh, wow.
Exactly.
Okay.
Also, the results. So the client is going to see results in the first week. They're going to note notable change within the first 7 days. They'll notice that the lines disappear. Once they make a few expressions, they're not able to see the lines. But it gets better with time. In about 4 weeks, you're able to see it has really worked, but now it can last from 4 to 6 weeks now, depending on, have you done Botox before? Are you used to doing it every other time, or are you a new person? That is what determines how long we're going to do it again, but mostly 4 to 6 months. And for fillers, it's a year. A year to 2 years, right? Yeah.
Yes. Okay.
Yeah.
So it's quite a journey, and just like you guys have said, I think it's important that everyone asks and then get the correct information about Botox. So have you seen botched Botox incidents, and how would a person be able to tell that, yeah, my Botox was a botch?
Okay, so we rarely have such cases, but we do not lack 1 to 5 in 100, you know, and mostly it's due to wrong administration of the Botox. Either you've given too much Botox or injected Botox in the wrong places. Remember, I told you there are landmarks we check while we are injecting, even on the forehead. We check to go 2 centimeters above the brow, because we do not want to affect the brow. And what we have, I told you earlier, called ptosis, that is the drooping of the eyelid. That could happen if the Botox was injected wrongly.
That's amazing. Thank you, guys. Thank you, Jean.
Thank you.
And thank you so much, Shiro, for taking us through the entire process. For anyone watching and is considering Botox, is a bit skeptical, what could you advise them?
So the first step, you need to know what you're getting yourself into. Go for it. Come, let's do a consultation, a thorough one, and I'll give you reasons why you need it and maybe why you don't need it. So the first step is coming in for a consultation. Yeah.
Okay.
Yeah, so don't be shy.
Thank you, ladies, so much. We've had a fantastic time. I've learned so much, and for the first time, I feel sold. Let me tell you, every time I hear about Botox, I'm like, I'm not sure. But for the first time, you guys are actually making me consider the possibility of getting Botox done. But we'll still, wacha nijite mkutano kidogo. But thank you so much, Shiro. Thank you so much, Jean. Thank you to you, Glow Aesthetics, for having us here today. Shiro, tell us your pages on social media, where can we find you?
So you can find us at Seattle Mall, along Kiambu Road, Block A, first floor, next to NCBA. Our social media platforms, YouGlow Aesthetics, YouGlow Kenya, on all handles. And for me, it's for the nurse_edit on Instagram.
All right, thank you so much. And until next Wednesday, please stay glam. And until then, mwah. Bye.
Bye. Now, for a client like Jean, oh my God, I'm nervous.
No, but you're doing so well.
Really?
Yeah.
Okay, just a minute.
It's okay.
Preservative.
Preventative.
Preventative. Kai tutakata.
Kunakuwa na kukata?
So you can start.
Yeah.
You know, the muscle. Oh, matatu. Boda.
Okay.